Technology is everywhere, and it's a vital part of our everyday life. It's really hard to imagine a life without technology. One place that technology is very important is the healthcare setting. I've worked in the health field for 3 years as a nurse, and I've seen a wide variety of technology that is constantly changing and improving patient outcomes. One type of technology in the healthcare is the use of machines. One type of machine is a medication scanner. It's kind of like a barcode scanner that'll scan the patient's armband and then will scan the medication. This allows the patient to receive this right type of medicine. It improves patient safety, and if the medication is the wrong medicine, then it'll just flag it and tell us not to give it because it's for the wrong, or not the right patient. Another machine is the portable vital sign machine. So you'll go in there and check the patient's vital signs, like the blood pressure, the heart rate, and the pulse, and you'll press the save on the machine, and then the machine will automatically send the information to the patient's medical record. So it can be pulled up anywhere in the hospital, and it's readily available, and you don't have to wait for the results. Phones are also important in the healthcare field because it improves communication between patients and other staff. There's also larger machines that are used, like the CT machine and the MRI, PET scanner, and according to Benova in 2013, numerous methods of imaging allow for technicians and physicians to examine a patient's anatomy without needed invasive procedures to form a diagnosis. Diagnostics have never been easier and more accurate. So these types of machines help the physicians see the patient's anatomy and determine a diagnosis without having anything invasive happen yet. So this is very important, and there's also laparoscopic surgery now too, where instead of having a large incision, like if you go to get your gallbladder removed, then you can have 3 little small incisions. And this improves the outcomes of patients because usually there's less chance of infection, and it also, the smaller incisions heal a lot quicker. Another form of technology is the electronic health records. According to one study done by the Health Information Technology in 2014, electronic health records reduce paperwork. So there's not a whole lot of paperwork you have to go keep up with or go track down. Everything's in one spot in the patient's electronic record. It gets information accurately in the hands of people who need it. So everyone who's in charge of that patient's care, it can go to one spot to find the patient's information. It helps doctors coordinate care and protect patient safety, and it also reduces unnecessary tests and procedures. So this, if a patient has multiple doctors taking care of them, this helps because all of the patient's information is in one spot. So if one doctor orders some tests, then all the other doctors are able to see what that test is. So the patient doesn't have to keep getting the same test done over and over and over again. And also, it gives the patient direct access to their health records. A new thing we had tried at the hospital was the patient portal. And this allowed patients, after they were discharged home, to go to their home and access all of their information from their hospital stay directly from their computer. So any tests, lab work, anything that happened while they were at the hospital, they were able to pull up. Another thing is the computer provider order entry, which is CPOE. And that means, or it's relatively new, it's where doctors would input orders or their notes and everything into the computer instead of writing down in the chart. This allows us not to get confused by different people's handwritings, and also it makes sure that things aren't just transcribed down wrong. So, and if something, an order is entered in, it doesn't get delayed before it gets done, because it'll automatically, the doctor will enter it into the computer, and he can enter it in at home or at the hospital, and it'll directly go into the computer and flag for the nurse to go ahead and carry out that order. Lastly, a relatively new form of technology is telemed. This telemed is remote access from a doctor. So the patient will be somewhere that could be miles away from where the doctor is, and they're able to use the use of computers and phones to take care of that patient. According to the American Telemed Association in 2012, telemed can help to improve access for patients. It's more cost effective, improve quality of patient care, and it decreases the demands of the patient. So the telemed app, or there's a telemed app that you can get on the phone now, that if you download the app, you can put in your information, and a doctor remotely from another location will look at the symptoms. They can view you over the camera and kind of diagnose you over that. That way, like patients with chronic problems or anything, they don't have to get in the car and drive somewhere to see a doctor, or if there's something that's minor, they don't have to go to an emergency room or anything, making it a little more cost effective than doing this over the phone than if they were to go to the doctor or the emergency room. Another thing is, when I worked in ICU, they used this form of telemed where if there was anything going on with the patient, we could hit a button, and there was a doctor that was usually several states away, but they popped up on the screen. So they could give us orders, they can zoom in and view the patient and see what's wrong with them, and we always had someone available 24/7 in case anything happened with our patient. There was a doctor, we didn't have to wait on a doctor to come in. They were remotely there. So there's so much going on with technology and in the healthcare setting, and it's so important because it improves patient outcomes and it allows patients to be in charge of their health care. It's really exciting to see what all healthcare how far technology has come in the healthcare setting and where it's headed.